cautious optimism. Those are the words that have been used over the last couple of days when it comes to the number of COVID-19 cases here in Toronto. We do know that that line is starting to flatten. However, they continue to go up. Let's have a look at the Toronto numbers right now. There are now a total of 3,820 COVID-19 cases in the city. That includes confirmed and probable. 281 of those people are currently hospitalized, with 109 now in intensive care. 223 people have recovered, but 190 people have now died in Toronto. Dr. Eileen de Villa says the trajectory of cases is lower than many other cities and regions in the world, so we're doing well so far.
We believe at this point that the number of cases to date in Canada, Ontario, and locally in Toronto is lower than originally forecasted, due in part to the strong public health measures that were put in place early in our outbreak and the fact that our residents took these measures seriously. We know that we will likely experience another COVID-19 wave because we have yet to reach a high level of immunity in our community. We will continue to see COVID-19 spreading in our community until we start to experience herd immunity. This will not happen until many people are infected with COVID-19 and recover, and they build immunity that lasts, or we develop a vaccine.
Other news now. With every passing day, the TTC is losing a significant amount of money. Ridership has dropped 80%, but service has only been reduced slightly. As a result, revenue is down about $80 million over the last month. That has many worried about possible layoffs, which is exactly what has now happened in Vancouver this week. TransLink has given notice to hundreds of transit workers there. So now a national transit organization is calling on the feds to help.
We're asking the federal government to support transit operations during this pandemic, and that cost of that would be approximately $400 million per month.
And I'm sure that we can find a way in discussions with our unions, as we did as a city, to make sure that they can take account of the fact that as things evolve with the crisis, that we're able to evolve how we use our workforce together, with that evolution. And I'm sure those discussions will continue to take place under Mr. Leary's guidance.
Meanwhile, the TTC and Toronto Paramedic Services have teamed up and repurposed 5 decommissioned buses to transport COVID-19 patients, including those on ventilators if needed. They are outfitted with stretchers and potentially have space for up to 13 patients, 3 paramedics, and 1 driver. Also news today that the city has received 3 million new surgical masks. They'll mainly be used for staff in the city's long-term care facilities and emergency shelters. Last week, city officials had said there was enough masks for 52 days at current consumption. This adds another 127 days or 60 days, worst case scenario.
This new influx of PPE will ensure that our staff continue to have access to the PPE that they require, as they help our most vulnerable residents in our shelters and in our long-term care homes.
Mayor John Tory took a few moments today as well to talk about a meeting he has had with other mayors from municipalities in the GTHA, talked about how they continue to work together before they actually reopen things to the economy. He wants to make sure, however, that they do get help from both the province and the federal government before they do so.